A very good evening to all. Good evening, Dr. Arjun. So today we'll be continuing yesterday's session of male reproductive system. So before the session starts, I'd like to call Ms. Ritika Kapoor to have the prayer.
Om Namami Dhanvantri Adidevam Surasure Vanditam Padapadanam Loke Zararuke Bhaya Mrityunasham Dadharisham Vibhit Aushadhinam Dhanvantri Pramanatham Sarvaroge Nivarakam Ayurved Prabhaktaram Vande Piyusham Dhayakam Sarve Jana Sukhino Bhavantu Sarve Santu Niramaya Om Shantihi 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 Om.
Thank you, Ritika. Dr. Arjun, you can start your session.
Thank you, Anil sir. So we will continue from the yesterday's class. So today we will see the accessory glands and the ducts of the reproductive system. Okay, so we have finished the external genitals, external genital organs, that means the penis and the scrotum, then the internal genitals, that are the testes, then the vas deferens, then the spermatophore. So all of this we finished. Then now we go for the accessory glands. Okay, so there are three main accessory glands. Okay, the seminal vesicle, then the prostate gland, and the Cowper's gland, or the bulbourethral. It is the Cowper's gland is also known as the bulbourethral gland. Okay, then there is one more gland. It is called as urethral gland, or it also known by a name, the periurethral gland. Okay, so the function of the accessory glands are the products of these glands serve to nourish and activate the spermatozoa, then to clear the urine prior to ejaculation. Okay, they nourish us and activate the spermatozoa, then clear the urethral tract. Okay, prior to the ejaculation, they lubricate the urethral tract, then serves as a vehicle to transport of the spermatozoa in the female tract, then plug the female tract after the placement of the spermatozoa to ensure fertilization. Okay, so there are three main accessory glands: the prostate gland and the bulbourethral gland. Okay, so they nourish us, activate the spermatozoa, then lubricates the urethral tract before the ejaculation, then serves as a vehicle for the transport of the spermatozoa in the female tract, and like the female tract after the placement of the spermatozoa to ensure the fertilization. Okay, so the first one is seminal vesicle. Here in the picture, this is the seminal vesicle. So the seminal vesicle is a gland that are located at the base of the prostate. Okay, it is located at the base of the prostate between the bladder, the rectum, and the vas deferens. Okay, so it is a pair. Okay, two in number. So it is located at the base of the prostate. Okay, so this is the base of the prostate. It is located at the base of the prostate. Okay, and it is situated between the urinary bladder, the rectum, and the vas deferens. Then each vesicle consists of a single tube folded and coiled on itself. Okay, so you can see it is a single tube coiled and fold on itself. Okay, so each vesicle consists of tube that is folded and coiled on itself with an occasional diverticle on its wall. Okay, an occasional blind tract on its wall. Then the excretory duct of each seminal gland unites with the corresponding vas deferens to form the two ejaculatory ducts. Okay, so the excretory duct of the seminal vesicle. Okay, each has one seminal one excretory duct. So they unite with the vas deferens to form the two ejaculatory ducts. Okay, so after puberty, the vesicle matures into an elongated sac-like structure. Okay, so after the puberty, they mature and elongated into a sac-like structure and produces a viscous white yellow fluid that contributes to at least 2/3 of the total ejaculate volume. Okay, so after the puberty, they produces a white yellow fluid. Okay, it is a 2/3 of the total ejaculate volume. Okay, then it plays an important role in the sperm motility and the metabolism. So the secreted fluid is rich in fructose. Okay, so the fructose, it is a sugar. Okay, it provides energy for the sperm. Okay, it nourishes the sperm. Then the coagulation protein. Okay, so it acts as a layer that protects the sperm. Then prostaglandins. Okay, so this prostaglandin, it is a hormone that reduces the immune system against the sperm. Okay, female immune system against the sperm. Then the pH. Okay, so it is the pH of the fluid of the seminal vesicle is neutral to alkaline. Okay, it is to reduce the acidity of the male urethra and the female reproductive tract. Okay. So the seminal vesicle is a pair of glands that are located at the base of the prostate. It is between the bladder and the rectum. Bladder, rectum, and the vas deferens. It connects with the excretory duct of the seminal vesicle, joins with the corresponding vas deferens to form the ejaculatory duct. Then the secretion from the seminal vesicle is the 2/3 of the fluid that is the total ejaculate volume. Then it nourishes the sperm. Then it acts as a protective layer for the sperm. Okay, the coagulation protein acts as a protective layer around the sperm. Then the prostaglandin reduces the immune system of the female response to the sperm. Okay, it reduces the female immune response to the sperm. Then the pH will reduce the acidity of the neutralize the acidity of the male urethra and the female reproductive tract. Acidic nature of the female reproductive tract. Then the wall of the seminal vesicle is composed of external connective tissue layer, then a middle smooth muscle layer, and an inner muscle layer. Okay, so it is highly folded labyrinthine in structure. Okay, so you can see it is labyrinthine. Labyrinthine means maze-like structure. Okay, so the wall of the seminal vesicle is composed of an external connective tissue layer, then a middle smooth muscle layer, and an inner mucosal layer, which is highly folded. Okay, it is labyrinthine or a maze-like structure. Okay. So you can see in the structure, in the picture, it is like a maze. Okay, so it is a labyrinthine structure. The mucosal layer is lined by cuboidal pseudostratified columnar epithelium. Okay, so it is lined by cuboidal to pseudostratified columnar epithelium. Okay, so then it is featuring typical protein secreting cells. Okay, so the pseudostratified cell means it is formed by a single layer of cells. Okay, so it is formed by actually a single layer of cells, but it gives an appearance of being made of multiple layer of cells. Okay, that is why it is called a pseudostratified columnar epithelium. Then the ejaculatory duct. Okay, so the excretory duct of the seminal vesicle along with the vas deferens ejaculatory. Okay, so the two ejaculatory ducts are each less than 1 inch. Okay, it is 2.5 cm long and are formed by the union of the vas deferens and the ducts of the seminal vesicle. Okay, so this is already told. It is formed by the union of the vas deferens and the duct of the seminal vesicle. Then the ejaculatory duct pierces the posterior surface of the prostate and open into the prostatic part of the urethra. Okay, it opens into the prostatic urethra close to the margin of the prostatic utricle. Okay, so their function is to drain the seminal fluid into the prostatic urethra. Okay, so each ducts are 1 inch in long or 2.5 centimeter long. Then they formed by the union of the vas deferens and the duct of the seminal vesicle. Then they pierce into the posterior surface of the prostate and opens into the prostatic part of the urethra. Okay, and its function is to drain the seminal fluid into the prostatic urethra. Then the prostate. Okay, so the next accessory gland is the prostate. Okay, so the prostate is an accessory gland of male reproductive system. Okay, so the secretion of this gland add bulk to the seminal fluid along with those of the seminal vesicle and the bulbourethral gland. Okay, so the secretion from the prostate gives bulk to the seminal fluid along with the secretions of the seminal vesicle and the bulbourethral gland. And the prostate is firm in consistency. Okay, so it is firm in consistency. So the firmness is due to the presence of dense fibromuscular stroma. Okay, so in which the granular elements are embedded. So the firmness of the prostate is due to the presence of a dense fibromuscular stroma. Okay, in that the glandular elements are embedded. Okay, so the fibromuscular stroma is a thickened area of tissue that surrounds the apex of the prostate. Okay, so it is a thickened area of tissue that surrounds the apex of the prostate. It is made up of the muscle fibers and fibrous connective tissue. Okay, so the fibromuscular area of the prostate is made up of the fibrous connective tissue and muscular fibers. And in the female, the prostate is represented by the PERIURETHRAL gland of skin. Okay, so the prostate is an accessory gland of the male reproductive system. Then its secretion along with the secretion of the seminal vesicle and the bulbourethral gland adds the bulk of the seminal fluid. Then it is firm in because of the fibromuscular stroma. So the site of the prostate. The prostate lies in the lesser pelvis. It lies in the lesser pelvis below the neck of the urinary bladder. You can see it is the neck of the urinary bladder. It lies below the neck of the urinary bladder. So this is the neck of the urinary bladder, and the base of the prostate lies below the neck of the urinary bladder. Then behind the lower part of the pubic symphysis and the upper part of the pubic arch. Then it lies in front of the ampulla of the rectum. Okay, so the prostate, it lies in the lesser pelvis below the neck of the urinary bladder. Then the lower part of the pubic symphysis and the upper part of the pubic arch. Then it lies in front of the ampulla of the rectum. Shape. Okay, so it is like an inverted cone shape. Okay, you can say it is like an inverted cone and measures about 4 cm transversely at the base, then 3 cm vertically and 2 cm anterior posteriorly. Okay, and it weighs about 8 gram. Okay, so its size is below the neck of the urinary bladder, below the lower part of the pubic symphysis and the upper part of the pubic arch. Then it is its shape, it resembles the inverted cone. Then it measures 4 cm transversely at the base, then 3 cm vertically and 2 cm anterior posteriorly. Then it weighs about 8 gram. Prostate presents an apex. Okay, so the apex, okay, it is directed downwards. Then a base. The base is near the the neck of the urinary bladder. Then it has four surfaces. Okay, one anterior surface, then one posterior lateral surface. Okay, it's also known as the inferior lateral surfaces. Okay, so two lateral surfaces, then one anterior surface and one posterior surface. Okay, and one base and one apex. So the apex is directed downwards and surrounds the prostatic and membranous part of the posterior urethra. Okay, so the posterior urethra has three parts: the pre-prostatic, then the prostatic, and the membranous part. Okay, so here the apex surrounds the junction of the prostatic and the membranous part of the posterior urethra. Okay, so the posterior urethra has three parts, and the apex of the prostate surrounds the junction of the prostatic and the membranous part of the posterior urethra. Then it is separated from the anal canal by the perineal body. Then the base is directed upwards. Okay, so the apex is directed downwards and the base is directed upwards, and it is structurally continuous with the neck of the bladder. Okay, so you can see in the picture, you can see that it is continuous with the neck of the bladder. Okay, in this picture you can see that. And the junction is marked by a circular groove which lodges the venules of the vesicles and the prostatic plexus. Okay, so it is continuous with the bladder, and the junction is marked by a circular groove which lodges the venules of the vesicle and the prostatic plexus. And the surfaces. Okay, so it has four surfaces: one anterior, one posterior, and the two lateral surfaces. Okay, so the first one is anterior surface. So the anterior surface is narrow and convex from side to side. It is narrow and convex from side to side. Then it lies 2 cm behind the pubic symphysis. Okay. Then it is intervened by retropubic fat. Okay, so it is narrow and convex from side to side. Then it lies 2 cm behind the pubic symphysis. Okay, so in between it is separated by the retropubic fat. Then its upper part is connected to the pubic bone by the puboprostatic ligament. Okay, so the puboprostatic ligament connects the pubic bone with the upper part of the anterior surface. So the lower end of the surface is pierced by the urethra. Okay, so the urethra is passing through the prostate. So the lower end of the anterior surface is pierced by the urethra. So the lower end of the urethra emerges from the surface of the anterior superior to the apex of the gland. Okay, so the lower end of the urethra emerges from the anterior surface, anterior superior to the apex of the gland. Okay, so this surface is composed of fibrous tissue. Okay, so the anterior surface is composed of fibrous tissue. So the anterior surface of prostate is from side to side. Then it lies 2 cm behind the pubic symphysis, and it is separated from the pubic symphysis by the retropubic fat. Then the upper part is connected to the pubic bone by puboprostatic ligament. Then the lower part of the surface is pierced by the urethra. Posterior surface. Okay, so the second surface is posterior surface. Posterior surface is triangular in shape. Then it is flattened from side to side and convex from above downwards. So the posterior surface is triangular in shape. Then it is flattened from side to side, then convex from above downwards. Then it is separated from the rectum by the fascia of Denon villus, okay, which is obliterated from the rectovisceral pouch of the peritoneum. Okay, so the fascia of Denon villus is a membranous partition of the lower end of the rectovisceral pouch. Okay, so it is a partition or at the lower end of the rectovisceral pouch. Then it separates the prostate and the urinary bladder from the rectum. Okay, so the fascia of Denon villus separates the rectum from the urinary bladder and the prostate. Then near its upper border, it is pierced on each side of the median plane by ejaculatory duct. Okay, so that is upper border of the posterior surface. It is pierced on each side of the median plane by the ejaculatory tract. Then this surface lies 4 cm from the anus and can be easily palpated on digital examination through the rectum. Okay, so the posterior surface lies 4 cm from the anus. Okay, so it can be easily palpated on digital examination through the rectum. Okay, so the posterior surface is triangular in shape. Then it is flattened from side to side and convex from above downwards. Then it is separated from the rectum by the pelvis. Okay. Then near the upper border, it is pierced on each side by the median plane by the ejaculatory duct. Then the surface lies, the posterior surface lies 4 cm from the anus and can be easily palpated. Easily digital examination easily palpated on the digital examination through the rectum. Then it has 2 inferior lateral surfaces. Okay, so the inferior lateral surface is related to the side walls of the pelvis. It is related to the side walls of the pelvis. Then the lateral surfaces are prominent and are covered by the anterior portions of the levator ani. Okay, so the inferior lateral surface are prominent and are covered by the anterior portions of the levator ani, and they are separated from the muscle by plexus of vein embedded in its sheath. Okay, so it is separated from the muscle by a plexus of vein embedded in the sheath. Okay, so the prostate has 2 inferior lateral surface. Okay, so the inferior lateral surfaces are related to the side wall of the pelvis. Then the lateral surfaces are prominent and are covered by the anterior portions of the levator ani. Then they are separated from the muscle by a plexus of veins embedded in its sheath. Okay, so the gland can be divided into 3 zones. Okay, so the peripheral zone, then the central zone, and the periurethral zone. Okay, you can see here peripheral zone or the transition, periurethral zone or the transition zone, the peripheral zone, and central zone. Okay, so the prostate can be divided into 3 zones. Okay, so the peripheral zone, then the central zone, and the periurethral transition zone. So the peripheral zone forms 70% of the glandular tissue. Okay, so this is the peripheral zone. It forms the 70% of the glandular tissue. Okay, then it is situated posteriorly and it is cancer vulnerable. Okay, so the peripheral zone is more vulnerable to the prostatic cancer. Okay, and it forms the 70% of the glandular tissue. And the next one is central zone. Okay, so this is the central zone. Okay, so the central zone constitutes 25% of the glandular tissue. So it forms the 25% of the glandular tissue and situated posterior to the urethral lumen and above the ejaculatory ducts. Okay. It is situated posterior to the urethral lumen and above the ejaculatory duct. There are 2 zones. Okay. Then the central zone is not involved in disease and is of Wolffian duct origin. Okay, so the central zone is not involved in any disease. Okay, so the central zone consists of 25% of the glandular tissue and is situated posterior to the urethral lumen and above the ejaculatory duct. And the last zone is the periurethral transition zone. Okay, so it is the transition zone. Okay, it forms 5% of the glandular tissue. So from which the okay, so it is more prone to the BPH. Then the central zone and the transition zone constitute the central gland. Okay, so the periurethral transition zone forms the 5% of the glandular tissue. Okay, so here this area is more prominent to the BPH or the benign prostatic hyperplasia. Then together with the central zone, the central zone and the transition zone constitute the central gland. lobes of the prostate. Okay, so earlier the prostate gland was described as having 5 lobes. Okay, so previously it was told as the prostate has 5 lobes. Okay, so previously it is told it has one anterior, then one posterior, one median, and two lateral. But as of now, it only has the glandular tissue divided into 3 lobes. Okay, 2 lateral and 1 median lobes. Okay, so the lobes are, there are 3 lobes, 2 lateral and 1 median lobe. Okay, so you can see here the lateral lobes and the median lobe. Then the prostate is covered by a capsule. Okay, so it is covered by a capsule that is composed of collagen, elastin, and okay, so a true internal capsule and a false external capsule. Okay, so the true capsule is formed by the condensation of the peripheral part of the gland. Okay, so it is covered by a capsule that is a true internal capsule. Okay, so it is covered by it is formed by the condensation of the peripheral part of the gland. Then it is fibromuscular in structure and is continuous with the stroma of the gland. Then the venous plexus lies between the true and the false capsule. Okay, so you can see here it is covered by a sheath. Then there is the capsule of the prostate. Okay, it is the true capsule and capsule. Between the venous plexus. Okay. So the venous plexus is embedded between the true capsule and the false capsule. Okay. So the false capsule, it lies outside the true capsule and is derived from the endopelvic fascia. Okay. It is covering the false capsule and is derived from the endopelvic fascia, and anteriorly it is continuous with the puboprostatic ligaments. Okay. And on each side the prostatic venous plexus is embedded in between the false and the true capsule. Then posteriorly it is avascular and is formed by the rectovesicular fascia of Denon villus. Okay, so the prostate is covered by a capsule, the true internal capsule. It is formed by the condensation of the peripheral part of the gland. Then it is fibromuscular in structure and is continuous with the stroma of the gland. Then the venous plexus lies between the true and the then the false capsule. Then it lies outside the true capsule and is derived from the endopelvic fascia. Then anteriorly it is continuous with the puboprostatic ligaments. Then on each side the prostatic plexus and venous plexus is embedded in between the false and the true capsule. Then posteriorly the false capsule is avascular and is formed by the rectovesical fascia of the Denon villus. And the ligaments of the prostate. Okay. So there are a pair of medial puboprostatic and a pair of lateral puboprostatic ligaments that extend from the false capsule to the back of the pubic bone. Okay, so there are a pair of medial puboprostatic at the back of the pubic bone. Okay, so the medial pair lie near the apex while the lateral pair is close to the base. Okay, so these 4 ligaments supports the gland. Okay, so these ligaments keep the gland in position. Okay, so it has 4 ligaments: the medial puboprostatic ligament and the lateral puboprostatic ligaments. Okay, they extend from the false pubic capsule to the back of the pubic bone. Okay, they extend from the false capsule to the back of the pubic bone. Then the medial pair lies near the apex and the lateral pair lies near the base. So these ligaments supports the gland. Okay, keep the gland in the position. The structures within the prostate. Okay, so the prostatic urethra transverses the gland vertically at the junction of its anterior 1/3 and the posterior 2/3. Okay, so prostatic urethra is the part of the posterior urethra. It passes through the prostate. Okay, passes at the junction of its anterior 1/3 and the posterior 2/3. Okay, Then the prostatic urethral. So it is a blind sac that directs upwards and backwards. Okay, the prostatic urethral is a blind sac that directs upwards and backwards. It opens at the middle of the urethral crest. Then the ejaculatory ducts. Okay, so the ejaculatory ducts pass downwards and forwards and open into the prostatic urethra. Okay, on each side of the opening of the prostatic urethra. Okay, so the structures that passes through the prostate are the prostatic urethra. Okay, so the posterior part of the urethra that passes through the prostate at the junction of the anterior 1/3 and the posterior 2/3 of the prostate. Then the prostatic urethral is a blind sac that directs upwards and backward. Then it opens at the middle of the urethral crest. The ejaculatory duct passes downwards and forwards and open into the prostatic urethra on each side of the opening of the prostatic urethra. And the blood supply of the prostate. Arterial supply. The arteries are derived from the internal pudendal, then the inferior vesicle, the reproductive arteries. Okay, so these branches, okay, the branches from these arteries form a large outer or subcapsular plexus and a small inner or periurethral plexus. Okay, so the greater part of the gland is supplied by the subcapsular plexus. Okay, so the arteries are derived from the internal pudendal, then the inferior vesicle and the middle rectal arteries. And the branches of these arteries form a larger outer or subcapsular plexus. Okay, so it forms the branches form a larger outer or subcapsular plexus and a smaller inner or periurethral plexus. So the greater part of the gland is supplied by the subcapsular plexus. The venous drainage. The veins form the prostatic venous plexus around the space of the prostate. Okay, so it is located between the capsule, okay, the true capsule and the false capsule. Then it drains into the internal iliac vein. Then it also communicates with the vesical venous plexus and the vertebral venous plexus. So the venous drainage, the veins from the prostatic venous plexus around the sides and base of the prostate. Okay, it is located between the capsule and the false capsule. Then it drains into the internal iliac vein. Then it also communicate with the vesical venous plexus and the vertebral venous plexus. The lymphatic drainage of the prostate. So the lymph vessels terminate into the internal iliac and the sacral lymph nodes. Okay. Then some vessels from the posterior surface passes from the lymph vessels from the bladder to the external iliac lymph nodes. Okay. So they drains into the internal iliac and the sacral lymph nodes. Okay. And some vessels from the posterior surface of the prostate passes with the lymph vessels of the bladder to the external iliac lymph nodes. And the innervation. The parasympathetic fibers arise from the pelvic splanchnic nerves and the sympathetic fibers from the inferior hypogastric plexus. Okay. So the innervation is from the parasympathetic fibers arise from the pelvic splanchnic nerves and the sympathetic fibers from the inferior hypogastric plexus. The clinical significance. Okay, so the inflammation of the prostate is referred as the prostatitis. Okay, then the benign BPH, the benign prostatic hypoplasia. It occurs in the periurethral transition zone. Then the carcinoma of the prostate occurs in the peripheral zone. The prostate is a common site of the carcinoma. It occurs after the age of 50 to 55 years. Okay, so the main conditions are the inflammation of the prostate. It is also called as the prostatitis, and the BPH or the benign prostatic hyperplasia. Okay, so it mainly occurs in the periurethral zone, periurethral transition zone. Then the carcinoma of the prostate, it mainly occurs in the peripheral zone. Then it is the most common site of the carcinoma, and it occurs after the age of 50 to 55. the next one is the bulbourethral gland. Okay, so the bulbourethral gland, which is also called as a Cowper gland, is a small gland, small yellow lobulated structure. Okay, it's approximately measures 1 centimeter in diameter and located lateral to the membranous urethra and the superior to the perineal membrane. Okay, so the bulbourethral gland, also known as the Cowper gland, are small round yellow lobulated structures measuring approximately 1 centimeter in diameter. Okay, in its position, it is located lateral to the membranous urethra and it is superior to the perineal membrane. You can see here, it is a bulbourethral gland. Then, during sexual excitement, the contraction of the muscle fibers lead to the expulsion of the clear mucus from the gland into the bulbar urethra. Okay, so during the sexual excitement, the contraction of the muscle fibers lead to the expulsion of a clear mucus from the gland to the bulbar urethra. The secretion of the bulbourethral gland comprises 5 to 10% of the total ejaculative volume. Okay, so it comprises the 5 to 10% of the total ejaculative volume. Then each bulbourethral gland consists of several lobules enclosed by a fibrous capsule. Secretory units are tubulo-alveolar in form. Okay, so the secretory units of the bulbourethral gland are tubulo-alveolar in form. So the glandular epithelium is columnar and secrete acidic and neutral mucin into the urethra. Okay, its primary function is to lubricate the junction. Okay, lubricate the urethra. So the bulbourethral gland are small, round yellow lobulate structures, and it measures 1 centimeter in diameter and situated lateral to the membranous urethra and superior to the perineal membrane. Okay, so during the sexual excitement, the contraction of the muscle fibers leads to the expulsion of the clear mucus from the gland into the bulbar urethra. Okay, so this secretion comprises 5 to 10% of the total ejaculate volume. Okay, so the bulbourethral gland consists of several lobules enclosed by a fibrous capsule. Okay, then the secretory units are tubulo-alveolar in form. It is lined by the glandular epithelium, then secretes acidic and neutral mucins into the urethra. Okay, so its function is to lubricate the urethra. Then the last one is periurethral gland. Okay, it's also called as urethral gland. So the periurethral gland are the most numerous in the penile urethra. Okay, so like the bulbourethral gland, they secrete mucus into the lumen of the urethra prior to the ejaculation. Okay, so it also have the lubricating function. Okay, so this periurethral gland also secretes a similar secretion like the bulbourethral gland. Its function is to lubricate the urethra. Okay, so by this we have finished the male reproductive system. So we have finished.
As as we are actually facing some high network issue here, I don't think that we'll be able to keep a discussion session for this. Maybe because of climate and cloudy weather, we are having some great issues in the network, sir. I apologize to students and also for you as we are not having a discussion session for this. If anyone have any particular or specific doubt, maybe 1 or 2 doubts can be allowed. You can kindly message it through the chat. Okay, sir. I hope there are no doubts. So we thank you so much on behalf of Department of Anatomy and also Shiva Ayurvedic Medical College. We thank you so much for spending these 2 days with us by giving a lecture on male reproductive system. And also we thank you for your valuable session too, sir. Thank you so much. Thank you, sir. Thank you so much. I hope you had 2
Okay,
great
thank you.
wonderful days.
Thank you for giving me this opportunity, and our college for giving me this opportunity. Thank you, sir.
Okay, sir. Thank you, sir. Thank you. Stay safe. Thank you, sir. Bye.